education. So breast cancer, we want to go beyond the pink ribbon for October, and you'll be seeing it in November, December, January. So we want to push it out of October. That's why I titled this Beyond the Pink Ribbon. So what is breast cancer? It's a type of cancer that starts in any of the breast tissue. So if you're a man, you have pecs, you have breast tissue, so that's why you get breast cancer as well. So it's not just a woman disease process, but because we do have more breast tissue than the men, we have more prevalence of it. So men do get it as well. Cancer can occur in any part of the body. You name the cancer based on what tissue it starts at. Next slide, please. Okay, so here are some statistics. This is from 2024-2025. There's about 316,950 new cases of invasive breast cancer. It is the second most common form of cancer and leading death for women. The first one is lung. About 42,170 women will die from breast cancer. That number's bad, but it's a improvement from before. And it's because of awareness program, talks, early prevention, detection. That's what's reduced the death rate. So as bad as that number looks, it was much worse. It was the numbers were more comparable to the total incidence. Breast cancer occurs in men too. 2,800 cases in men. As you can see, the disparity is a big, big difference, but it does happen. 42,000. So death in men is about 510. So again, a big difference, but it happens. Lifetime risk, one, if you're looking at this room here, in every setting that you're at, 1 in every 8 women is diagnosed with breast cancer. And then if you've localized diagnosis, meaning early detection, you have a 99% survival rate. So this is why we're really pushing, because you can have the disease and you can survive. But when it's late diagnosis, this is when the death occurred, and that's what we're trying to prevent here. Next slide, please. So we see numbers here, just kind of like a graph look of what it is. And I wanted to point out, just to kind of give a comparison, if you are in a room, there's 20 Caucasian women that have breast cancer diagnosed, and then you have 10 African American women in the same room, so a total of 30 people. There's probably 5 of the Caucasian that will die versus 9 in the African American that will die, right? So that's why I want to give you that visual comparison. I'm more of a visual person. We can, next slide, please. Next, okay. So although there's an increase in new cases, new diagnoses, there is a decrease in overall death rate because of awareness, early detection, and clinical research and new treatment modalities. Next one. All right, so there's different types of cancer. In situ is the earliest stage. It's a very, very small nodule. And those, you probably wouldn't even be able to find those on a manual exam. That type of cancer is most likely detectable by mammogram only. So that's why it's really important. And there's ductal carcinoma in situ. They're localized still within the breast tissue itself. The invasive one is when the cancer have grown outside of the breast tissue. It has extended elsewhere. And there's stages of the tumor. Stage 0, very curable versus stage 4, there is no cure, just palliative care until disease process has taken over. Next one. So this is what it kind of looks like if you comparison of what the stage, so that will give the importance of what I'm trying to stress here as far as early detection. Here's the stage 0. Here's the breast nodule. Those little green chain that you see that looks like the tree, that's the lymph nodes. That's basically the pathway, the highway where the cancer can travel to the rest of the body, right? If you have the breast cancer localized and it starts to grow and get into the lymph nodes, it's a high probability that it will metastasize, meaning invade other part of your body, brain, lung, and other organs. So as you can see, stage 1, 100% survival rate. They can get it. Sometimes you may not even need chemotherapy. They can just remove it, and then you go on into surveillance, which they continue to monitor you. Because now that you've had the cancer diagnosis, you're at higher risk and require more frequent monitoring. Stage 1, 98% survival It's still within the breast tissue, but a little bigger in size. Stage 2, 88% survival rate. Stage 3 and 4, they typically do not, if you're talking as in terms of cure, because there's two types of cure, either curative intent or palliative intent. So if it's early stage, they can cure it, you can live disease-free, right? This is when they go and say, I beat cancer, I'm cancer-free. So that's curative intent. But stage 3 and greater, there's no I'm free of cancer. It's palliative, meaning you're trying to keep the disease process from getting worse. And then when the tumors in other parts of the body, they're in places they're not supposed to be, you're giving the treatment to reduce the side effects, the pain and things like that. So that's palliative. When you're in palliative, you're trying to give the person more time. Okay, like my daughter's getting married. I need palliative so I can meet that birthday, meet that wedding, meet the grandchild before I go. So that's the importance. It's about time now versus cure when you get to stage 3 and 4. Next stage, please. Next slide. So here are some of the risk factors. These are non-modifiable. You can't do anything about that. Female gender, no matter what identification or whatever, there's nothing, you're at higher risk of breast cancer if you're female. Age as you get older. I know the number says different, but I still feel 25. But realistically, my risk is different now than it was when I was really 25. Family history. It's really good to know your family history. I know culturally we don't like to talk about things. Everything is so secretive and private. Mind your business type of thing. It's really important to know your history because that helps us, the providers, identify your risk level. Do we need to do other testing like genetic testing? Because if you have a first relative like a mother, father, grandmother, sister, aunt, immediate family that's had the cancer, chances are it's genetic. You have a genetic mutation that makes you prone to having cancer, not just breast cancer, other cancers. So if you know the history, then we can go further and do genetic testing to see what your risks are and what we can do to reduce that risk, because there are certain medications that you can take if you are at higher risk. So these are some of the gene mutations that are known to increase your chances of developing breast cancer later on. Caucasian women have a higher incidence. However, African Americans have a higher mortality rate, right? So this is what I'm trying to hone in. Early menarche, late menopause, meaning if the young ones that have their periods very early, and I'm seeing that a lot, or late menopause because of different hormonal changes in the body, that puts you at risk as well, because some of the breast cancer genes are hormonal based. And then if you have dense breast tissue or some other benign breast disease, for example, cysts, some people are more prone to cysts, it puts you at a higher risk. It doesn't necessarily mean 100%, but it means that I have a higher risk, so I require more frequent monitoring. Next slide, please. Okay, modifiable risk. These are some things you can do something about: obesity, inactivity, poor diet, alcohol consumption, smoking, radiation exposure, hormone therapy. Now, I want to go back to the radiation exposure because a lot of the common myths that I hear about when I'm doing teaching and I'm trying to promote for women to go and get mammograms, they said, well, I've heard that all of the exposure from the mammogram all the time is going that you're getting. So I wanted to talk about that. Okay, so those are some of the modifiable risk factors. Next slide, please. Go back on. So factors that may reduce your risk. If you're women, you're breastfeeding, it's been shown that women that breastfeed, that can breastfeed, it reduces their risk of breast cancer. Physical activity, exercise, at least greater than 150 minutes per week. So that's like walking for half an hour 5 times a week. It's very simple, very easy to attain. If you just want to do an hour 3 times a week, however interval works for you, but you know, that's the magic number. That's the bare minimum. You want to aim for more than that. Dietary, reduce your intake of red meats and processed meats. So processed foods, the sandwich meats, the hot dogs and things like that, really reduce those. Diet rich of fruits and vegetables, fish, olive oils, things like that help. You are what you eat. Your vitamin D, we historically are known to have the lowest vitamin D deficiency, and that is such a protective factor, not just for cancer, but for so many other things. So when you have your labs with your PCP, pay attention to your vitamin D levels, and it's easy to take the over-the-counter one, the 2,000 IUs per day, or if you're really deficient, they'll give you the 50,000 units per week. So that's one that's really helpful in health maintenance. So maintain healthy weight, limit alcohol, avoid tobacco, eat a balanced diet, and have your screenings done, regular screenings. That's with your primary care and whatever else. It's really important to pay attention to your primary care. They look at your overall health. They look at the different guidelines based on your age groups, your risk and everything, and then they refer you. And so pay attention to those and do follow them. Next slide, please. So some signs of symptoms of breast cancer. You may have a lump or a mass, changes in your breast shape. You can have dimpling or redness in the skin, nipple discharge or inversion, pain or swelling. However, typically, there are no signs, no symptoms. Tumors are typically, when they're small and forming, they're usually painless and not noticeable right away. If you start to actually notice physical signs, you can see visibly one breast is bigger than the other, or the shape has changed, something is really advanced if you can actually start to see it with the naked eye. So that's why the screenings are really important. You don't just wait to do something when you see something, because by the time you see something, it's advanced. And there should be no discharge from your nipples unless you are breastfeeding. And that's really the only time. No blood, no clear fluid, nothing at all. So if you see any of those, you can stand in front of a mirror when you get out of the shower. You can put both hands on the hips like this, and it should be slightly, and nothing is perfectly equal in your body, even your arms and legs, but it can't be a big noticeable difference. So you want to check that too. Next slide, please. So what is the lump? A lump is a mass in the breast. It is the most common form of breast cancer. There is inflammatory breast cancer. It looks swollen, very swollen and heavy and painful. Those are rare. The lump is the most common side. You feel a little nodule, sometimes you can see it. But some of us do have dense breast tissue or cyst. So when you see it's just something that is not normal, you take it, let your doctor know, get the clinical breast exam, mammogram, ultrasound, until they can actually rule out and say, okay, it's not a malignancy, which is cancer, it's just a cyst, it's just this, we'll continue to watch. As long as we, figure out and rule out what it is exactly. So it's important, as soon as you see something, any mass, any lump, changes, you see something, say something. Okay, next one, please. So these are some of the signs you'll see. Lumps. The armpits too is very important because this is the chain of your lymph nodes. Any abnormalities happening, the lymph nodes tend to get really swollen and tender. So if you start to see in that armpit area, it's good to have that looked at to figure out what the issue is. Inverted nipples, changes in the shape and size, redness, swelling, breast pain is not usually common for cancer to be painful, but if you want to check it out. Next one, please. So the screenings, the most basic screening, and this at our table, if you'd like to stop, I would definitely love to talk more about it. The monthly breast self-exam. We encourage the monthly breast self-exam to start as soon as the young lady starts their menstrual cycle. So this is the teenagers. If your nieces, your daughters, your goddaughters, we start at that age because that is the most baseline their breast would be. If they perform it every single month, they will know exactly what their breast at its normal state feels like. So the minute there is any type of change, they will be the first to know and report it to the provider, their doctor, to have further evaluation. What we recommend is that you do your monthly breast self-exam every single month. If you still have your menstrual cycle, you want to do it at least a week before or a week after the end of your monthly cycle. You do not want to perform this during the menstrual cycle. The breast is a little more sensitive, it changed during that time, so it's not a good indicator. If you no longer have menstrual cycles, what I recommend is take your birthday. And on that date, so I'm May 7th, so on the 7th of every month, that's when I perform it. So you pick that same day and perform it at the same time. And so that's the basic form. The next one is your clinical breast exam. This is when you go to your yearly visit, either with your primary or your OBGYN, your gynecologist. The next level, if those two screenings, there's something abnormal, we go on to do a mammogram, a screening, a diagnostic mammogram. And then if that still is abnormal, you go further to the ultrasound, MRI, or possibly biopsy. So those are the levels of screening to diagnosis. The guideline it now recommends, because I'm seeing patients younger and younger, I can't tell you how many young ladies at age 20 and 30 that I'm currently treating for breast cancer right now. So it's not a disease process of the older woman, age 50 and up. I have patients in their 20s. So the guideline is women can start to have their mammograms at age 40, yearly mammogram age 40 to 45. And if those are okay, then you can go on to do it every other year up to the age 74 if you're at normal risk. Now, if you are at higher risk, then some women have to do it every 6 months if they've had cysts and things removed. And some women, if you're at higher risk, have to do it yearly. What other risk factors that they determine how early you can start. Now, the insurance typically are not going to cover it if you're in the age 30. However, that was diagnosed with breast cancer at the age of 40, you can start getting your mammograms 10 years prior to that age of diagnosis, so at the age of 30. So knowing that history, you can speak to your doctor about it. They can submit a claim or prior authorization to the insurance to justify, yes, she needs to do it at age 30 because this is the history, this is her risk factor, and then it will be covered. But that involves a conversation and knowing your risk, and so you can advocate for yourself. Next slide. So the mammogram is the best way to detect breast cancer in its earliest stage. The smallest, naked to the eye, you can't see it, the mammogram is able to catch that. So even if you do your monthly breast self-exam, you don't feel anything, and it is the time frame that you should get your mammogram, do not skip it, because you can find it if something is there, a malignancy there at its earliest stage, and where you can see the different stages where you have 100% survival rate versus the 16% survival rate. So that's the importance of mammograms. It has reduced over the past 10 years, by 20 to 25 over the past 10 years, reduced the mortality rate because of how many malignancies we've caught early on before they were even palpable during an exam. And with mammographies, about 80% to 90% accurate. And why those numbers are like that, let's say I had a mammogram in January, it was negative, and then now there's something in December. It may have even been much smaller than that. That's why sometimes you go when you have the mammograms and they're manipulating because they're just trying to make sure they see everything. So work with the tech, they just want to make sure we get as accurate as possible so that nothing is missed. Next slide, please. So if they find something suspicious in the mammogram and they say, now let's have an ultrasound. I know if you hear something like that, me too, being human, I will be in full-blown panic between that next visit where I'm having that ultrasound. What it could be a cyst. It could be a benign nodule. When it's benign, it's just something that's hard and there's no cancer to it, but it requires, they go in, ultrasound, they may do a biopsy, put it under the slide to actually look at the cells, and then they tell you it's just benign, we'll continue to watch. So those are the things. So if they tell you you go for a mammogram, yeah, we see something that doesn't look too well, I don't want you to go out and start planning your funeral right this minute. It is done, it is well. No, let's go to the next levels and make sure we rule out what it could be, because there's other things that it could be. Next one, please. So those are the ACS guidelines, what the studies, research have shown when we should start. Age 40 to 44, we can begin to, even though some can do it even earlier than that, depending on the risk, up to age 74, and after that, you don't really need to. All right, next slide, please. So the importance, the key message that I really want to stress is early detection leads to smaller tumors, less invasive treatment, and better survival outcomes. 5-year survival for localized cancers, those are some that are big, but they're still within the breast tissue, and death rates have decreased significantly. We used to be in the 100,000s. Now we're less than 50,000 because we're just trying to get that message across and so forth. Next one. So again, take home message, know your body. If you see any changes, you'll be the first to know. Know your family history so that you can know your risk if you require genetic testing. Report any changes early and follow the guideline and empower others to do so. This is not on the slide. From experience being in this field for a long time, one of the things that I see, we do have a lot, we know our culture, and we do have reasons why we don't trust the healthcare system that much. And this is why we try to empower people that look at like us to work in these fields so that we increase, the trust and so that we can go and receive care. There are some people, sometimes they are diagnosed, and it is at an early stage. But by the time they come back to start treatment, the cancer's already advanced to a later stage where we have better chance. So everything that we told you, this is the treatment plan, this is what we're gonna do, let's start. You come back 2 to 3 months later after you've tried to do the Tapolosol, what's the other one? You went to do everything else, all of that. And then you're like, okay, I'm ready to start now. Okay, we have to do new imaging. We do new imaging, it's in your lymph nodes, it's in your lung, it's everywhere else. Now we're talking, forget everything that we talked about before. So now it would appear that I lied to you earlier, but it's not the case. So if you have any family member that ever comes to you, oh, mammogram was this, but I'm going to do X, Y, and Z, please, I encourage you to not promote that. Not that I don't do my T's, I love my culture, but not in this instance. I encourage you and that's why sometimes we hit up the churches and do these things in the church, because I can say the same thing and I treat patients. But if I tell my pastor, go tell this person, she's gonna listen, but I've been speaking to her for a whole month. So we try to go and reach the people where they're at. So if you're the trusted family member that they come to and confide in you and tell you this is what's going on, okay, when's the next appointment? What's next? What's the next step? Be that person that empowers them to continue to start treatments. Even seek a second opinion. I encourage that. I say, okay, sure. I'm with you, Sylvester. Go check out Memorial. Go check out Baptist. Have them do their own set of tests and then compare the notes. Because if it's the same disease process, it could be a different in medication, maybe 1 or 2, but not the whole treatment plan, right? Because we go by evidence-based medicine, right? So you tell them, and I'm quick to tell them, I'm with you, Health Sylvester Cancer Center. Go get a second opinion with Baptist. Don't get another second opinion with another doctor within the U, because the thought will be, oh, this doctor saw this doctor, so, and they're just saying the same thing. No. Go in a different system, and then you pick, but don't delay it. Make sure the second opinion, you get it within a week, and do not wait longer. So that's what I encourage you to be, that person to empower your family members, your loved ones, or friends to seek help and not delay care. Next one, let me see what's on. So these are some resources: Florida Breast Cancer and Cervical Cancer Early Detection Program, the Department of Health, the state. I encourage you to just go look at those sites. Resources are available at different times. Sometimes you have mobile units that have free mammograms at different locations, but if you check those websites, you can see what's available. The HANA office is always available too, especially for this breast cancer. So if you have your women ministry or a group of your nieces and nephews, and you want us to give them that education, give us a call and say, hey, can you meet us at the office? What day is good for you? Bring a group of 10. We will gladly sit there with the breast models to teach them how to properly do it, hands-on, how they feel it, what they're looking for, how to do it, because our goal is to really prevent, reduce the complications of late-stage diagnosis. So Hannah's here for you, and I think that's all I have. Thank you.
Thank you so much, Madam President. All right, we had a very powerful day, and it's at the end, so we let you out pretty much a good 45 minutes earlier. So give our presenters a big round of applause. So this morning we learned so much. We had intimate partners violence and awareness. We did holding space for wellness. We did human trafficking awareness and prevention panel with Emmanuel. We did relationship-based philosophy with Dr. Valdez, health and wellness tips with Dr. Lumana. With Dr. Espera, we have HIV and AIDS, and we just finished our breast cancer. So that's a lot of information that we received today, and then I know that we are all empowered to speak to our loved one and really share the information. At this time, I'm gonna bring our very own chairwoman and also the president, CEO of MGD to do special presentation.
Wow, Dr. Lozama, you did an amazing job. Thank you so much, everyone who's here since 9 a.m. to 4 p.m. Thank you so much. And now we have some of the presenters that left, but now we're gonna give the special gift, a certificate of recognition for their time, because it's not easy to have them, lose one day of work to make that happen. Thank you so much. We're gonna call them one by name. Dr. Etienne, I think she's outside. Let's call the women here. Emmanuel gonna have the certificate receive the certificate for the human trafficking. Emmanuel, come on please. Marcel, come with us. Because Martia is not here, so she's gonna, Marcel is from the University of Miami. Yes, so stay here with us. No, stay here. Yes, so Emmanuel, we give it to Emmanuel. Yeah, all the human trafficking. Stay here, don't go. Dr. Etienne is here. Yes, so, oh yeah, we're gonna take the picture later. Yeah, with all of them. Milnel, Dr. Yes. Milnel. Dr. Esperant was here. Dr. Lozama is here. Dr. Lozama this way. And then Emmanuel will have the rest because most of the panelists was for him. He will bring it to them. Where Dr. Esperant? She was right here next to me. Okay, maybe she went to the restroom. Oh, by the way, before everything, remember in the back of the book, there is a QR code. Please donate because we need your donation. Tomorrow night we have our fundraising gala. At the same time, we have an after party. If you cannot make it to the fundraising gala, we have DJ Paz. You just saw him, and then he's gonna give you a discount for the after party. The gala, it's $200, but the after party, Paz has that in control. So see DJ Paz, so to make your purchase for your after party. Thank you.
And don't forget Saturday.
Yes,
Saturday is very good because it's a festival. It's the health festival. That's the first time we have in this community where you have music, you have health, we do everything on Saturday. So all the information is in the back of the book. Thank you.